हाय फ्रेंड्स, गुड इवनिंग। आई एम डॉक्टर आशुतोष गुप्ता एंड आज हम दो बहुत अच्छे केसेस के बारे में बात करने वाले हैं इन विच आई एम गोइंग टू एक्सप्लेन कि हाउ अ मैटरनल कंडीशन कैन अफेक्ट द डिसीजन रिगार्डिंग द फीटस। ओके, सो दो मेरे पास केसेस हैं इन फैक्ट and both of them the mother is having ADPKD, right? So it is an autosomal dominant polycystic kidney disease and over the period of time हमारे पास एक अल्ट्रासाउंड मोडेलिटी से 40 साल पे when she is pregnant and we do have those wonderful criteria by which we can really identify that she is having an bilateral ADPKD. So this is autosomal dominant and then the kidneys are very enlarged and all those stuff, and by doing some investigations for the kidneys we can identify that she is landing into a CKD, the chronic kidney disease, right? And in that case, in both these cases she is having twin pregnancy and with self eggs, right? So it is not an IVF with an ovum donation which changes the scenario. So this is a natural conception, meaning thereby that she is using her own self eggs and she is having DADC twin and both the mothers are having bilateral ADPKD, right? तो मैं वो दिखा देता हूँ आपको. So this is the first case. Okay, तो ये maternal kidney है. So what we can see कि ये बहुत enlarged and then we do have a lot of cyst across and this is happening in both the kidneys. So what we are dealing at the moment is a bilateral ADPKD, right? She is conceived as twins, right? And then this is a transvaginal endovaginal ultrasound that we are doing. इसको ध्यान से देखिए तो what we can identify कि left renal fossa empty है. So what we are seeing is a left adrenal gland. ये right kidney आ गई है. This is what we can see and visualize is the right kidney. Left renal fossa is all empty. ये left adrenal है. So meaning thereby that probably presumptive diagnosis that we are dealing with a single isolated kidney, right? And so meaning thereby कि उन दो babies में से किसी एक baby को हमको reduce करना है. So what we are doing is sort of an anomaly scan at 12 weeks, right? So फिर हमने दोबारा कोशिश करी देखने की कि let us see how the baby is behaving. तो ये ध्यान से देखिए कि ये left ectopic है, left renal pelvis में left ectopic kidney है, right? This is the left kidney. This is the left kidney which we can see is an ectopic और right kidney के नीचे पड़ी हुई है. So left kidney है which is there at the lower pole of the right kidney, right? You getting my point? So this is a left ectopic kidney in one of the fetuses, right? And similarly this is the second case. तो ये this is huge honeycomb and all those stuff, and so it is a bilateral ADPKD with CKD with a chronic kidney disease. So she is not a right medical candidate for a pregnancy, right? But anyways that she is having a twin pregnancy, so we have to decide which baby to reduce as a matter of fact. Okay, so वैसे तो दोनों babies हैं लेकिन थोड़ा सा ध्यान दीजिए ऊपर वाले baby में. So probably we will try to see the left kidney, right? And then we are doing a presumptive diagnosis of an prenatal onset ADPKD. Prenatal onset ADPKD का presumptive diagnosis बनाने की कोशिश कर रहे हैं by seeing the echogenicity of the renal parenchyma, right? So what we can eventually see is a thick echogenic renal cortex in the left kidney of the twin one, which is the upper one, which is the upper one. So just in a minute we would see that kidney, right? So here it is maternal bilateral ADPKD with chronic kidney disease with self natural conception DADC twins. So medically she is not an ideal candidate to carry twin pregnancy. So meaning thereby that we are all justified in reducing one of the pregnancies and giving her and decreasing the load so that she can carry one pregnancy to something around term or preterm, right? Now which baby to reduce, right? Okay, so we are doing a presumptive diagnosis of because it is ADPKD, 50% could be a chance that one of the fetuses could have an ADPKD, right? So 12 हफ्ते पे ही ये देखने की कोशिश कर रहे हैं किडनीज की इकोजेनेसिटी, रीनल पैरेन्काइमा की इकोजेनेसिटी देखने के से ये we are making a presumptive diagnosis ki which of the baby is the healthier of the lot of both of them and which should be left alone. पहले वाले किडनी में तो ऐसा था कि we made a provisional diagnosis of a left ectopic, and the second kidney was second fetus had a good kidney, और second case में भी ऐसा ही हुआ कि one of the kidneys we could identify that the kidneys were ecogenic, even though the in the second case the fetus which was the upper one which we reduced was the bigger one, right? So we have sacrificed the bigger fetus as compared to the smaller one with an ecogenic kidneys, right? Okay, so this is how the maternal conditions dictate our fetal medicine decisions, right? Thank you very much for your patient listening.